I'd like to introduce Claire from England, who has Lyme disease. Welcome, Claire.
Hi.
Could you tell us your story, basically?
Oh, I'd better start at the beginning. In 1988, I got toxic fume poisoning from smouldering polyethylene, which severely affected my immune function. I recovered a little bit, and then I was gradually getting increasingly ill. I didn't know why, and it turned out that I was becoming allergic to all sorts of everyday things because of non-functioning immune system. That was, yeah, I said 1988. And then in 2003 autumn, I developed a mild form of so-called ME, which later was diagnosed as Lyme disease a lot later. And then just over a year later, the mild form left me able to still do work about half the time. I was a potter, that's how I had my living. But acute bronchitis on Boxing Day 2005 started then. Started an underactive thyroid. I'd always had a bit of a sluggish thyroid anyway, and the Lyme disease got going. I never recovered. I was floored from that day on. I couldn't work, socialise, couldn't do anything.
So how old were you when all this started?
Well, I was born in so I was 49 when the mild form of so-called ME started, and 50 when I was struck down. Good. Well,
So,
until this day.
what did the doctor give you?
What do you think? Nothing. Haven't got a clue. Sympathetic, but the doctor said what you need to do is eat organic, get an allotment. He didn't seem to work out that I hadn't got enough energy to dig an allotment. I did get one, but I couldn't do anything with it.
So how did you hear about LDN?
That was about a year or so ago. In let's see, in 2005, a friend of mine who's a scientist who knew she had Lyme disease but hadn't been diagnosed finally found one GP in the country who was treating people, and so I went. She said she thought I had it, so I went to him, and I did have it, and he's been treating me since 2005, and gradually killing off the bacteria and microfilarial worms, because I've got them as well. Cryptostrongylus pulmonii is sort of a common word, but I think they've changed the name recently. And as I was gradually getting better, but I used to plateau. I'd have a series of treatments and I'd keep plateauing, and so he'd keep introducing or altering the treatments. And when I got to a reasonable stage, he said, okay, try LDN. And so I did, and I'm now on, I take 10 milligrams twice a day, which is a pretty high dose, I know, but that's how much I need. I built up gradually from whatever it was, the lowest amount, one gram, or half a gram, or whatever.
So how did you find LDN when you first started? Did you have any symptoms, side effects?
No side effects. I just kept increasing the dose until it did what it was meant to do, i.e. give me a bit more energy. And this is the first year for several years that I haven't had hay fever, which only developed. Everything went wrong when I got ill in 1995. I've been perfectly fit, extremely fit, healthy, energetic, very energetic, and then everything went wrong. I developed just about everything except plaque on my teeth.
So, other than the fatigue, has the LDN done anything else for you?
It's mainly improved my energy and immune function, and it's an ongoing process. I know it's still helping. I don't tend to pick up the local bugs. I do take lots of immune boosters if there's a slight hint of a sore throat or a sniffle. But it would have developed, in the past, it would have developed a little bit. Now it doesn't really. So it's definitely strengthening my system.
What would you say to other people with Lyme disease who are thinking of trying LDN?
I'd say try it out, starting on a very low dose. You start off, I think it's half a gram once or twice a day, and build it up by 1 gram a week. You take it, and I'd say try doing that until you, as long as you don't get any adverse reactions, until you continue increasing the dose, 1 gram a week, until it's doing you some good. But my scientist friend tried it, and she said it. Oh no, I got that wrong. Sorry, forget that. That was CoQ10.
Okay.
Didn't do anything for her. Yeah, that's what I'd say. Give it a go.
Mhm.
It's not too expensive. I get it online. I think I get it from Canadian River Pharmacy CA, riverpharmacy.ca. That's in Canada.
Well, we can't put that in it either because
Okay.
it's actually illegal to do that, so we can't tell other people.
Okay. I get it. I got it through an online search. You can say that, can't you?
Yeah, yeah.
It took quite a lot of searching to find it. There are an awful lot of similarly named pharmacies, but this is the best price I can get it for.
Okay.
It's in 50-gram tablets, so I have to chop them up. Which is
Wouldn't
easy.
you rather have it compounded in this country?
I'd rather have it for free. Yes, of course.
Well, any doctor can prescribe it, and on the NHS if they think it's a therapeutic benefit. None of this is going to be on the recording, by the way. But
no. But they're not allowed to. You know, they're not.
They are allowed to.
Well, they're not.
They're allowed to do it off-label on a named
educated
patient.
enough.
Ah.
They're not. I've told my doctor all of the things I'm taking.
Yeah.
And she's everything by the book. The previous doctor had actually had Lyme disease, or she still had effects of it. She'd had it very severely, and she prescribed me all sorts of things to help. But I wasn't on LDN, and she left. She retired. So I've still got certain things like glucosamine with chondroitin and vitamin B.
But I mean, I was just saying that any doctor can prescribe it if they think it's
I've asked, but she says it's not within,
so that's just
it's not
your
within the NICE
doctor.
guidelines.
Yeah. There are many people that do manage to get it on the NHS.
Yeah, it depends on your doctor, but mine's fairly young. She's in her 40s, and well, she's doing it by the book.
Well, the book is actually, you can do it if she was to look at the evidence. But never mind.
I have asked, but because
I know, I believe you. But there are lots of
because I haven't got an NHS diagnosis of Lyme disease, because they've never even tested me. And even if they did, I don't, because I haven't had a tick bite and haven't got a rash, and a bullseye rash and all that standard stuff. More than 50% of people don't get the bullseye rash. Yeah.
But you can still get,
because I haven't gone through those particular hoops, jumped through those particular hoops. They're not even prepared to consider it. Although they do say on my medical record.
But we're actually recording this, so I just wanted to
okay.
get.
They do say there's a possibility of Lyme disease, but that's as far as they'll go.
Yeah. Well, all that will have to be cut out. But I mean, is there anything else you want to add to other people who are in a similar position that you're in, or you were in before you found LDN?
For Lyme patients, the only thing you can do in this country, as far as I know, is to take the advice of someone like Dr. Sarah Myhill, who is on Lyme. She was stopped from practicing, as has my private practitioner been stopped, and he's waiting for court proceedings in October. But because there was a huge outcry from all her patients, or thousands of her patients, she was reinstated. So she's got a lot of advice online, but the thing is, she's expensive. She's probably a perfectly reasonable price for what she does, but
I won't be able to put that in either, because
okay, do an online search for things like CFS treatment. And there are lots of supplements you can take. Obviously, certain medicines, a mix of antibiotics. There's a very good help website called cpnhelp.org. Chlamydia pneumonia is one of the co-infections. You can put that, can't you? They've got fantastic information on there because quite a lot of the people there do have Lyme disease. It's a really good website, really nice, well-informed people, and cheerful. And there aren't any nutters, which helps. do get them on some of the Lyme sites. People who go a bit over the top. Yeah, just don't give up. Keep searching, because if you're not too ill, you do stand a chance of at least some level of recovery if you take a lot of supplements and the right medicines. But you have to find out which ones to take, which is quite a difficult search on your own. But you can find the advice and moral support, which is very important. Knowing that other people, lots of other people, are going through exactly the same thing. They've all been told it's all in the head and doesn't exist, and you can't have it or it's incurable. All these kind of things. Yeah.
Well, thank you very much for sharing your experience with us, Claire.
I'll just say one more thing. If you get treatment within 2 years of it starting, you stand an excellent chance